fruit, real nuts, real medleys. Try our apple nut harvest bars. Wake her up. What's in my...
We have some questions about not only knee pain, but a couple questions about plantar fasciitis. So plantar fasciitis has to do with the fascia that's going to actually attach the muscle to the skin or some of the muscle fibers to each other. But plantar fascia comes right down the bottom of the foot. And so when it gets too tight, a lot of times you'll have a stabbing pain all the way up to the bottom of the foot. And so we're going to talk about addressing that. There's a couple different options. You can use a friction type massage, or you could use like a spoon or a butter knife or just your thumb, and you could just simply go along the fascia, along the bottom of the foot, and that'll help for general relief. And generally, if you go to a podiatrist or a foot doctor, they're going to attack it that way. I'm going to talk a little bit more about the causes. And this is your tibialis, your shin bone, your tibia. There's a muscle behind it, and we call it your posterior tib or the back side of your tib, but really it's a muscle that comes all the way down the inside of this shin bone, wraps all the way underneath the foot, and comes right down. Because it's responsible for the twisting back and forth of this foot. So a good way to alleviate this pain is to start here in the tibialis, reach right behind the bone, and again you can use your fingers, and you'll know if that's the case, because if it's really tender when you press behind that bone, then it means that it's caught. So you just want to find that you can either massage it by hand, or there are lots of different tools you can use. We're going to use a laser touch 1 here, and it's an immediate pain relief device, or pain management tool is what it's called. This device simply uses light therapy, and it moves the blood away from the nerve ending and promotes healing. So a different option other than some of the high friction release options would be to just use this pain relieving device, get the blood moving, and again, you'll have immediate results. You'll know if this is the cause of your problem after just 1 application. Lotion, you could use Vaseline, you could use spit. What we want to do, and this is a friction massage tool, is I'm now simply going to use a high friction massage and get on that muscle just behind that tibialis bone and just dig it out. So it's going to be really painful, it's not going to feel too good, but what it does is it detaches this muscle from the skin. Sometimes it gets stuck, and other times that muscle will get bruised and it'll stick to the bone. But either way, when that muscle gets too tight, it then pulls this foot over to here, so it's over rotated, and then the toes need to come all the way back to compensate, and then that causes the additional pressure or the pain through the plantar fascia. So again, you could use a tool, you could just use your thumb, but again, you'll know when you find it. You just keep following it all the way up and down. So this works to alleviate a lot of undue knee pressure, ankle pressure, and or plantar fasciitis. If you ever find yourself having pain in the Achilles tendon right here where it gets inflamed at the bottom of the heel, exact same thing. So this simply tight muscle is responsible for a whole lot of dysfunction that people end up getting orthotics for, getting surgery for. Now, I'm not saying not to go and check with your physician, because maybe you do have a legitimate problem. But a lot of times with a lot of people that I help, simply alleviating the pressure here in this posterior tib muscle will alleviate the pressure not only in the foot, but the pain in the foot as well as in the knee. So it's tough work to do, but it's a really simple fix, and it should work immediately. Again, tibialis bone, there's a set of muscles that travel just behind that bone. They're responsible for the rotation of the foot. If they operate correctly, then the foot can move in a straight line. If they operate incorrectly, we start getting twisting of the ankle, twisting of the foot, plantar fasciitis, and or knee pain. So you want to apply as much pressure as you can tolerate, and then release as much pressure as you can tolerate. And again, it should help immediately. So that's plantar fasciitis, posterior tib. WeHateLarry.com.